So this is part two with Ken Weaver here, and this is his neural check, by the way. This is the test back in October 3rd versus today, and today is December 12th. So what we're looking at here, this is all based on what's called heart rate variability. Heart rate variability is the distance between each beat and the variableness of that. So this beat was 60 beats a minute. It shouldn't be every second. That's not healthy, and so this is it should be more variable than that. So instead of every 1 second, it'd be maybe 0.5 seconds or 1.5 seconds or 0.7, 0.19. All those are going to be the ones that we want to see. And so the more variable it is, the better it is. So we can see here on this chart here, this is a very powerful before and after. So this was back in the one on the right side was October 3rd of this year, 2023. We can see a pretty substantial battery backup at this. The total body power was 665. This is the basic power to get all the jobs done that you need to get done throughout the day. Walking, talking, eating, everything's based on this body power. Low energy. When anything less than 1,000, sometimes there's people who just have a hard time getting out of bed. So you can see that this is a strong battery backup. This green section is the rest, digest, and heal section. And this yellow section is the fight or flight response. So we can see the difference between October 3rd and today. This battery backup went down, so this means that we got more body energy. Total body power went up to almost double, almost to 1,200, that's 1153. And then what's very impressive is that the high frequency, or the sympathetic, the parasympathetic, which is the rest, digest, and heal, went up from 11% to 24%. So a lot more energy is on deck. I mean, we're talking double.
Yep.
And that's
like it too.
Yeah, you have double the energy that you did. Now it's not where it should be. Where should it be? You can see this top slide here. This green section should be around 40% total body power, and that's when things are really rock and roll and things are really going good. The sympathetic or the yellow section would be at around 30%, and this battery backup would be about 30%. So that's the normal pattern there. Stress index was at 251, now it's at 99, so a lot less stress. The vegetative pattern differential, this is the pattern of dispersion as far as that time versus heartbeat variance is nice and getting healthier. It was at 0.15, now it's at 2.0, which is a lot better. So this cluster here is not as good as it should be. It should be more randomized as far as kind of like this. That's more of an equilibrium state right there. The next stop is the psycho-emotional state. This was, having this diagnosis and going through all this is definitely a stress on the system and the brain, and you can see that there's definitely some stress here. I like to see this around 80%. This is what it kind of should look right there. This is right now, back in October it was at 36%, now it's at 45. Definitely improvement. Not where it should be, but definitely better. This brainwave activity here is still a little bit off. We definitely need to get back on the brain tap technology. This is going to help restore the normal brain wave activity. Anything over 35% delta is going to have a hard time with brain detoxification. The brain actually has lymphatics, and those lymphatics need to be activated every night. So when this is normal brainwave activity, like this pattern here, high delta and beta, high alpha and beta, which is this blue and this green section, about 70% of the brainwave activity during the waking brain should be about that, and about 10% should be delta. You can see that's actually reversed here with this, and so we still need some work on that for sure. One of my favorite slides to show patients is this level of harmonization and also the age versus biological age. And so this is all, again, based on heart rate variability. Level of harmonization, this means the body's systems working better together. I just see around 50%. It was at 34% back in October. Now it's at 43. Definitely moving in the right direction. Not quite there yet, but definitely improving. That's the main thing. And then also the biological age back then was actually 59. Actual age was 63. Today, 54. So versus 63. So as far as biological age, I love this little metric that they have here with this. Times are still the low points in the day: 9 o'clock, 3 o'clock, and also right around bedtime. And then we can look at the last chart here. So the heart rate variability was a 5. 20 to 50 is the index that this software uses. and now it's at a 6. And so definitely moving in the right direction, but definitely recovering from a pretty substantial health challenge. So overall, way to go. And I just want to explain this to not only you, Ken, but also to the family of Sunridge as far as one of the technologies. All again based on heart rate variability, which are these paddles here. The right one goes to the right side, left one goes to the right, left arm, and then we check about 300 beats, and then get that data point. This is one of the tools that we use to really assess the speed of recovery. So the more the body power, the faster people recover. The bigger this green section is overall. That's the true thing as well. And then even on this one here, what is stressing you out? What do we need to do to de-stress? And there's a lot of software in the BrainTap programs that can help do that. If you just type it in the search function area, if you type in stress, there's many programs that can be utilized to help de-stress. But you also have to ask yourself, what is causing stress with you? What's the top 3 things? Usually those come to mind, and we want to try to mediate that as much as possible. We also want to do the top 3 things that help us reduce stress. What would that be? It could be any number of things. It's what you like to do to de-stress. And so you got to do more of that. So his stress level was at 251, now it's at 99. 10 to 100 is really the ideal. So it's still in the upper limit of ideal, but still definitely moving in the right direction, which is fantastic. So way to go, Ken. All right, so I hope you all have a blessed day.